Okay, we could call the order, the meeting to order. Is that correct?
You are,
Yeah, I can.
yeah, you are, Helene, it's your meeting, so you're good to go.
Meeting to the order. It is now 7:32. And
The only
we,
thing is, you need to roll call everything
Yes.
from the start to, right, the
exactly, I know that. So roll call, Helene Lieb here,
Ah, here I am. I'm here, Lee Jenkins.
okay?
Mary McGoldrick here.
John Chapman here.
You hear that, John Chapman? Yep, yeah, go on.
Mike Wheeler here.
Like, yes, and Bob, Robert Hillman, you're
Bob Hillman here.
okay. And Thomas Baker's here, Tom Baker,
Yep. Tom here.
and Tom Baker, and Lee has been muted, but I'm unmuted.
Mike Dick is here.
Yeah, Mike Dick is here. And Lee, you're here, right?
Yes, you hear me?
Yes, yes, it's fine. So we have, those are, did you get everything, Meg?
Yeah, who are we missing? Who's not here?
And
Oh, Fran. Okay, hold on.
Fran is the only one that I can't see.
I know, and I missed somebody, but I'll figure it out.
Right, I tried to teach him how to do Zoom, but he hadn't downloaded Zoom. That was, we figured out that was the problem. Okay, and then we have guest. Okay, right? And Chris, do we need to record the guests who are here?
Yeah, like a normal meeting, so you
Okay, so
get myself,
yes,
Tom
so
Hyatt,
senior town manager, and we have Don. Okay.
Yeah.
From our finance.
nice shirt there, Don, I like it.
Okay.
Thank you.
And we have Paula, right?
Right,
And what's your last name, Paula?
Linares, treasure collector.
Yes. And we have our fire chief, Bob Sylvia. And we have Glenn Pratt representing the emergency management, I believe, right?
that's correct.
Exactly. Did I have everybody?
And Chief Quigley's on.
Yes, oh yes, of course.
Yep.
Chief Quigley from the police, and then Pam Fahey, and you represent
Health agent.
the health agent, right? Exactly. So that's everybody. So the first order of business is to rescind the authorization from July 10th, 2019 for $89,750 for the pay. It was towards the painting of Town Hall. Is that correct?
That is correct. We essentially asked for this money because we thought we were going to have to do a lead abatement method when we were painting Town Hall. Michelle Leary found out during her research that we in fact did not have to do that. So we didn't spend any of the reserve fund transfer, and that's why we're asking for you to rescind this at this time.
So you're saying, Don, we didn't have to do de-leading? Is that what you're saying?
Correct. There was a way, however they did it, satisfied the lead abatement or lead, I think they covered it the way they painted it instead of having to abate it. Michelle could probably do a better job explaining it, but essentially we did not need to do that. And the original budget from capital request of $99,000 was spent with the exception of about $1,300. So.
Okay, and if anybody has any questions, just raise your hand, and then you normally just mute yourself unless you have a question now, okay? So we don't have, and if you have any phone or, like alongside you, mute that. Question, who had a question? Lee Jenkins. You have to unmute you, okay? Unmuted. I can't hear you.
Okay.
Okay, now I can hear you, yes.
Okay. What was the original bid price for that paint job?
The bid price
Yeah.
was around the $99,000 range. I don't have that information off the top of my head, the actual bid. I can find that out for you.
That's all right. Just curious. Okay. Thank you.
Sure.
And we did, Lee, just to, if you remember, we had this, we were afraid we had to do the extra work. We didn't have to do the extra work, and we actually came in on time and on budget. So the good news is that we stayed within the original authorization.
Which was $100,000. Okay.
Well, yeah, I think it was 190. I think it was like 99 technically.
That was
99.
town meeting. Yeah, that's right, Brem. Okay, thank you.
Any other comments? If you have a comment, just raise your hand and unmute yourself. Any other? Okay, so we have, then we need to make a motion. Is that correct, Chris? To rescind the authorization. Is that correct?
Yes, that is correct.
So we need a motion on the floor to rescind the authorization from July 10th, 2019 for the $89,750 for the painting of Town Hall.
So moved.
Second.
Okay, did you get that, Meg? Who moved it?
Seconded? Was that you, Lee?
John
Okay,
and Lee.
John and Lee. John first.
got it.
Okay, and all in favor of rescinding the motion, please say aye. And you could do it at one at a time if possible. I think that's, just raise your hand and then I'll just tell her. And unmute. Just-
John Chapman, aye.
Okay, just do it that way.
Lee
Yeah.
Jenkins, aye.
Okay,
Mary McGoldrick, aye.
Meg Wheeler, aye.
Mike
Tom Baker,
Tillman,
aye.
aye.
Mike Dick said aye, and who else? Tom Baker, you said aye? Okay,
So
Rob,
did Hillman.
okay, Robert Hillman said aye, and I say aye, okay? So we have how many votes then? That should be 8-0. Is there anybody against?
Send you a new link.
Right, so it's 8-0.
Okay,
Okay, we got that?
you got.
Great. So the next order in the agenda is the emergency operations update.
Excuse me, Helene.
Yes.
Fran just called and he doesn't have the appropriate link. Would there be a way, Chris, for you to send the new link for the Zoom meeting tonight?
Yeah.
He's trying to get in.
Who am I sending it to?
Fran Collins?
Yeah, I'll do that right now.
Okay.
Yeah, he probably will have trouble getting on Zoom because I don't know if he downloaded it. He was able to.
It worked yesterday with Tracy. He just had the link for the practice session instead of for this one.
Right. And John disappeared, but hopefully he'll come back. And so Chris, do you want to present the emergency operations update?
Actually, if you want to do,
First, we're going to do the reserve fund transfer
right,
request.
and that'll be, I think Don will walk you through that.
Yes, okay, Don, you want to do the reserve fund transfer request for emergency response. Did you all get to read the COVID-19 costs?
Yes.
Yes, because it totaled up to $95,232.82. And we could go per line item if you want, Don.
Yeah, so the first line item in this summary is essentially,
Point of order,
Excuse me, Don. Excuse me, Don. What, Mike?
could we give Fran a chance to call in before we start in on this? Because this is the heart of what we're doing tonight, is it not?
Yes, it is. But I'm not. It took him a while yesterday. So what do you want to do, Chris, about that? Should we wait?
Well, it's up to you. If you want to hold, if you want to just flip over to the emergency management update.
Okay, why don't we do that?
I did send this out to Fran. So if he's going to get on, he'll be on in the next couple of minutes.
Okay, and if he's not, he's. So you want to do so we're going to change the agenda if that's okay with people. All in favor of, switching over right now while we're waiting for Fran, and we're going to just wait a little bit. The emergency operation update, are you all in favor of that?
Sure.
Say aye.
Aye.
Yep.
Do we need to make a motion for that or?
Yes, we should. Chris, shouldn't? Where's Chris? Yes, I believe so. Yes. So make a motion to switch so we could have the emergency operation update first. Okay, all in favor?
Sorry, who made the motion and who seconded?
We didn't make, no one made
There-
that.
Fran. Never mind. Fran's coming in.
Oh, Fran's coming in, so we can go with it. So don't worry about it.
Oh, I got Fran. Okay.
It's not Fran yet.
Yep.
Oh,
Fran.
there
I
it
just
is.
let him in. Are you there, Fran?
Great. So let's
Computer
go.
audio, how's that?
Okay,
Perfect.
Gotcha.
You're using computer audio. Can you hear me now?
We
Yes.
can.
Yes.
We can even see you.
Hi, John.
so for the purpose,
Somehow the,
excuse me, Fran, can you mute? Okay, yes. For the purpose.
why am I
of
not
the-
talking to you?
Yes, you mute it for now. Do you know how to mute it? So anyway, for the purpose of the meeting, Meg, just put it down in our notes what time you came in.
Yep, got it.
Okay, so that is, I believe, 7:42. Okay, so Don, take it away.
All right, so if we're looking at the summary that I provided, the first line item there are actual costs that Glenn has summarized from the departments. So every time a department has either ordered something or has paid a bill related to COVID-19, they've been sending it to Glenn to summarize so that we could get potential FEMA or MEMA reimbursements in the future. But until then, we also want to cover these costs now with reserve fund money instead of asking to go into deficit spending and do this at either year end or next year. So the first 42,000 are actual costs incurred to date, hard costs, inventory, things like that. Not a lot of payroll included in that, which we'll get to later. Sorry, can everybody still hear me?
Yeah. So,
Oh, okay. I think Chris is sharing the screen. I'm sorry.
all right. Yeah. Okay. That was.
All right. So yeah, the first line, actuals submitted, and then the next few are really estimates. The next 3,500 is a potential order that we're going to be putting in, pending approval for electrostatic sanitizing equipment. From my understanding, the sheriff's office has been coming in to sanitize with their machines, town hall, police, fire, their vehicles. So this will allow us to do it ourselves and be self-sufficient instead of relying on sheriff's department. Next line item, ongoing maintenance of negative air containment. This was set up at the police station, cost of about $500 per week. And this essentially allows the officers to bring in anybody that they need to bring into the jail, the cells, in a specialized area without affecting the rest of the station. Chief Quigley or Glenn could probably do a better job explaining, but that's essentially what that is, from an estimate of $500 per week from now until June 30th. We're also providing meals to seniors, and that is being provided through the school department with their school lunch people. They're incurring the cost. They've determined a cost per meal, and that is an estimate going from now until June 30th as well. And then the next two lines of 20,000 each is just an estimate of ongoing orders of PPE through June 30th, and then also payroll and other unanticipated expenses from now till June 30th. Estimate is 95 and change. I rounded up to an even 100 for the reserve fund and transfer request. So this is definitely going to be a big help. There is some other money that we've received. We received about $6,200 from Massachusetts Health Organization. No, is it Health Organization, or it's a Mass Health grant that will be used from the Board of Health and the public nurse. And then Chief Quigley has also submitted a federal grant application for funding for police-related activities as well. But the 100,000 here is to essentially cover costs we've already incurred, and then hopefully be a good estimate of costs that we expect from now till June 30th. Any questions?
Any questions? Okay, one at a time. John, you can unmute, John.
Sorry.
Okay,
Okay,
question.
it should be unmuted.
Yes, it is.
Okay. Yeah, that on the attachment, the town department one in particular,
Sure.
could you or one of the others just give a general sense, doesn't have to be itemized, of how this breaks down between essentially protecting, some of it, things like sanitizer seems to be just protecting town operations for something that was unexpected. Are there things in there as well, though, that look like they might be actual, call them public health or other non-normal activities that have been undertaken because of the pandemic? Can you just give a sense of how those, in aggregate, how that breaks down?
I don't really have that answer for you now without going through and summarizing it by PPE versus sanitizer versus other.
Well,
I could do that for you.
maybe another way to ask it is, are there any major items in there that are supporting non-normal activities as opposed to protecting the normal activities? Like the piece here on the police department, the negative pressure, that's basically protecting the normal policing activity as opposed to some unusual activity. The meals for seniors is an abnormal activity necessitated by the virus.
Well, I guess, John, if, for the Zoom platform, we weren't using until a month ago. So IT had to acquire licenses. That's an example of something that's,
Yeah.
yeah. Is that what you're talking about?
Yeah. But just scanning through the 40,000, it looked like, to my eyeball, it looked like most of it was in the first category. There wasn't as much as I would have expected in the way of sort of non-normal activities necessitated by this.
Yeah, in order to make this platform work and to tie into 143, we had to buy an adapter for 143 TV, and then we had to pay for the licenses. So that's probably the biggest IT expense. And there's been a few more. I don't know if they're in this at this point, but we've had to pick up a few more pieces of equipment because there's people working from home that are not normally doing that. So we had to ramp up our laptop, which is, again, that's going to be useful anyway.
Yeah, Chris, can you show the, do you have it on Excel, how the 41,000 breaks off?
Yeah, it's actually in the sheet that Don, here, I can share it.
Just
too.
the other tab of that sheet.
For a moment with people, because that may answer a lot of potential questions. Yeah, does everybody see that?
I don't know how easy it is to see everybody, but
Yeah, well, it explains where it goes, the money.
Right.
Cartridge, you know, like a lot of it, Hingham lumber, disposable gloves, padlock, hand sanitizers or wipes, Lysol. You got an N95 respirator. You got one of those, I guess, at Hingham Lumber.
they're actually masks. They're the masks.
Yes, it's yes, they just said respirator, but it's the N95 mask.
Right. So you can see there's and again, we had to pick. We've also ordered some new signage. For both at the for example at the beach.
Right.
New signs at the beach. We've bought some new signs at the RTF because we've changed how that's set up. Things that we otherwise, and again, they're not crazy big expenses, but they weren't planning on thing to do.
And the chart you put on Outlook for us, right? That's part of that's the page 2 part.
Yeah, correct. If you just click on that, everyone should have that.
Yeah, I saw it briefly.
Right, and again, I think that the single biggest expenses really have been PPE type stuff. Again, as John points out, we spent a few $1,000s in signs and IT equipment. A little bit more of that. We're trying to limit equipment purchases. Really, I mean, some towns have run out and bought $20,000 pieces of sanitizing equipment. I don't think it's a really good idea right now because we don't know what's coming next. I think we've been, again, as you heard, that we're exploring some of these smaller units that could have utility beyond this anyway. But again, most of this really is just stuff to ramp up our supply of PPE. We're also getting some free stuff from the state that said we need to keep our stock because you just can't trust that we're going to get deliveries. And I don't know if you want to add anything to that, Glenn.
Yes, we've been we're carefully watching what we call the burn rate on some of these disposable PPE equipment. Michelle Leary is purchasing stuff every day. We're giving it out to the departments, and we're also asking MEMA to supplement us. We do have a hard time getting approved because they're also doing a calculation on everybody's burn rate, and we're a small community, so others need it more.
Okay, and Mike, Dick, you have a question. Unmute yourself. Yeah.
Hi, everyone. Glenn, just tremendous, terrific job you've been doing with the emergency management, as well as you, the two chiefs, of course, Chris and Don. But I know you've been, everyone's been working hard, but you especially. I have some additional questions on the overall spending. The meals program for seniors, is that going to continue past June 30th? How many meals for how many people and for how long? I have several questions.
Sure. What we're doing, and if somebody wants to jump in on me, I believe we're doing, so we were doing Meals on Wheels anyway, so this is supplementing that. The school had the food, it was gonna go bad, and there were seniors who needed it, so correct me if I'm wrong, I think it's 3 days a week we're doing that, and it's like a grab and go stuff. It's like a brown bag, like yogurt or sandwich or something, and we're doing that. I believe it's 8. I want to say there's 17 or 18 people in the Meals on Wheels, and there's another, and there's a little bit of overlap. There's another 17 or 18 people without a pure overlap that are getting these supplemental meals as well.
The supplemental meals from the last spreadsheet I got from Nancy LaFosse via the school lunch director, I believe it was $100 a day, $4 per meal at maybe 25 people, something along those lines, and then extrapolated to June 30th based on, like Chris mentioned, 3 days a week. It's about $4,000 or $6,000 estimated in that spreadsheet.
Now, again, remember, Mike, we normally provided meals anyway, and so we used to do lunches, right? So these are replacing those. And the only reason that we have an additional cost is we're buying stuff via the school. Basically, we're sending money back to the school on this because this would have been paid for out of their lunch program. Because we're in a position we're not really cooking anything at the kitchen right now. I'm hoping that we will be able to return to something a little more normal by June or July for sure. And there is also a chance that we could end up having to ramp this up a little bit if people get still stay stuck at home. But at this point, it's been going pretty successful.
Great. I have a question now on the ongoing orders of PPE. That is a round number, and I know it's just an estimate. But what do we need as a town for PPE, say per month, and how many months out? I just want to make sure that we've got enough here for that.
Well, the biggest variable is the police and fire department for EMS equipment, masks and gowns and those kind of things, and then the police also. So there's no telling how many units they're going to use per day because they don't know how many calls they're going to have. So that's a good question. It's just our best estimate. We received 100 gowns and 700 of different type masks from MEMA last week, but we're burning through them about 450 a week at the fire and police station of what they call procedure masks. So we just never know. So we are continuing. It's a very long lead time on almost anything we can find that anybody will even agree to take our order on. And none of the items they don't expire, so we'll put them in our inventory cache at the EOC. Some of the items that we've opened up and started using for this emergency, when I looked at the packing list inside the box, they've been at the EOC since 2006. So they're just things we need to have, and we don't know the answer, but we appreciate the question.
So question then for Chris and Don, can we go beyond June 30th in this allocation, or by rule do we have to come up with a supplemental budget on the 1st of July?
So this is only through June 30th. Again, we got to pay attention to fiscal years. So again, this is why this is our best estimate, and hopefully it's a reasonable one from now until June. Again, we have a little wiggle room. If this isn't, we can come back to you folks between now and the end of the year-end transfers, or we could ask for another reserve fund. Rescinding that 89,750 brings us back to our original reserve fund transfer budget anyway of about 234,000. So, well, to answer your first question, yes, we would have to do a supplemental one for FY21.
Okay.
But we'll just have to kind of see where it goes.
Yeah, and to piggyback on that, Mike, we are looking at the budget again anyway. So, if police and fire and emergency management are looking, and if we need to there's already money in the budgets for these things, but not necessarily to this extent. If there's budget adjustments that need to be made, we're going to make them before we present it. We're going to be coming back to you in a couple of weeks with an amended budget, most likely. We've already been looking at that, and we're not ready to go into deep dive into it tonight, but it's on the there'll be a timing update later. We can start touching on it. So if there's a consensus that we're going to need to put more in the budget for next year, we're going to put more in the budget for next year right up front.
Really, my question is, should we be putting more money in now to avoid any kind of pinch or difficulty with town meeting being held, just so that we can go past June 30th?
I think we're, again, Glenn or either of the chiefs can correct me if I'm wrong, but I believe that we're set up to keep a stock on hand that in a worst case scenario can tide us over, for a period of time. And again, I don't know if we're talking about weeks or a month or more at this point. It should be okay. Again, no, that's a good question.
I'm trying to give you more money and you're not
Right,
taking it. That's okay.
Okay.
No, again, if we, I think we're okay. And again, if either of the chiefs.
Thank you. Fran wants to ask a question, so can the rest of you mute? And Fran, unmute you. Just unmute yourself. Okay?
Let's see.
You did it. You
I
did
am
it.
unmuted, okay.
Yes, you're welcome.
The question on the masks, Glenn, I assume that the fire and police are using the N95 masks. And I'm wondering if we can be part of that reutilization, that re-sterilization program that some of the other towns and cities are using. Is there any way we can send these things to get them, rehabilitated, if you will?
Actually, I'll pick up on that real quick. Obviously, we're using both procedure masks, little show and tell,
right,
and the infamous N95s that are hard to come by. Glenn, we'll give Glenn credit for this. Glenn found out that at the schools, we actually had UV cabinets in the science labs for the disinfection of the goggles and glasses that they wear. So we repurposed those, one to the police department, one to the fire department, and one to DPW. So we are actually able to disinfect our N95s in-house. So we didn't have to go up to Somerville to Battelle Industries with everybody else. So far, it's working pretty well. What we've done with the EMTs is we've issued them all two N95 masks, and they rotate them. So one for a call, they come back, it goes in the cabinet, and it takes a total of a half an hour to disinfect it, and then it's off and running. So we're really trying to maximize the usage of the N95s to the best we can.
Excellent.
Excellent.
Thanks, Bob.
Okay, any other question from other people? Okay, Chris, so you want us to take a vote about the reserve fund transfer?
We would if you would be willing, yes.
Yes, it's 100,000. So it's close.
Correct.
If you look at this summation, it's, what is it? $95,232, $233.82, but you would like 100,000 for a cushion.
That's what we would like.
Okay, is there a motion on the floor?
And that's the form. So,
Yes, yes.
I'll make a motion to transfer $100,000. I don't know what account, to the reserve fund?
Yes.
From the reserve fund.
From the reserve fund.
For the emergency response.
For the emergency response.
Okay, is there a second?
Second.
Second is Fran. And I'd like a vote now, oral vote, for those in favor of passing this motion, who are in favor of this motion. Okay? So.
One at a time?
Yes, one at a time, out loud.
Fran, aye.
Okay, Fran, yes?
Aye.
You all unmute? Okay, all unmute.
Can you say your names when you say aye, please?
Yes.
For the record taker.
Yes, okay, so start with Fran.
Fran, aye.
Okay.
John Chapman, aye.
Mary McGoldrick, aye.
Lee Jenkins, aye.
Rob Hillman, aye.
Aye.
Okay, Helene Lieb, aye. And Tom, how about
Tom
you?
Baker, aye.
Meg Wheeler, aye.
Okay, and Mike?
Mike,
Oh, I think
aye.
Mike did it. I heard, yeah, I got it.
So everybody had their vote. You heard everybody. And Lee, you already voted?
Yep.
Correct.
Okay,
I think I got everybody.
it's 9-0. I think we're all here, which is,
Colleen?
and I said yes, aye. Okay, so that motion has passed.
Okay, I have a question.
What is your question?
If I could just get again the amount in the reserve fund before and after the transfer, please.
Okay,
So-
Don?
One, upon rescinding the the July 2019, the balance was 234,090. We're transferring 100,000 out, so we'll have $134,090 left in the reserve fund.
And that's good till June 30th?
Till June 30th, correct.
Thank you.
Welcome.
Madam Chairperson,
Yes.
just a point of information. We did apply for a grant through the Bureau of Justice Assistance, and that's for approximately $78,000 in reimbursement. So the feds have freed up a lot of money for this crisis, and they've actually streamlined the process. So we should know something on being able to replenish these funds through that grant sometime in early to mid-May.
So 78,000 would go to the COVID-19 fund?
Yeah, this grant was specifically for police departments to reimburse and to purchase equipment and cover overtime costs and things like that for this for COVID-19. So we did apply for that last week, and again, we've applied for a lot of federal grants, and the process is arduous. But this one, they've really streamlined things. It seems like they really want to assist local communities with this. So it seems like a good grant, and hopefully we'll be successful.
Yes, so Chief Quigley, we could actually get reimbursed for some of the money that we just spent.
Yes, $78,000.
Yes, okay.
For some of that, so the overtime and some of the payroll that Chief Quigley is referring to in the grant is not included in the number that we're providing at this point. So I think there's about 15 or 20,000 of hard equipment that he's already incurred that is also part of the grant. That portion would be taken out of anything we charge for the reserve fund.
Okay.
So it wouldn't be the whole 78. I just wanted to clarify that.
Okay, it wouldn't be the whole 78,000. So right, so that grant wouldn't pay for overtime. Is that what you're saying? Or it would?
It's basically, it's for anything related to this
Oh,
emergency.
great. Okay, that's good to know. Any other questions about that before we move on? Because we're going to move on to the emergency operations update. Okay, emergency operations update.
Okay, so thank you very much for that. This is a very, very unique time. The way we count, we're in day 46 because we were in on this on March 1. We were the first community outside of Boston to have a confirmed case. And it's been nonstop since. Though we've done a lot of preparation work in anticipation with no expectation that things would get quite as hairy as they did, as quickly as they did. That said, as we start this, I just want to, again, reiterate my personal thanks for all the incredible work that both chiefs have done, that Glenn has done, that Pam has done, Mary Goodwin, the folks at IT who've moved us from an analog platform to a digital platform, which is, takes a lot of doing, and they've made it work. And we were able to do this tonight because of a lot of work of staff members and a lot of great investments over the last 4 years that have made this infrastructure possible. And there's folks that we don't think about as much. You know, the RTF is open, and we have folks up there every day. You know, they're on the front lines as well. Works crews are working, our folks in the senior center are working. We have a rotating cast of characters here at Town Hall. The clerk's in every day. We have rotating people, so there's no more than one in an office. Really, Tracy and I overlap a little bit in the afternoons, and she's usually here in the mornings, and I'm physically here in the afternoons. So there's been a lot of work going on, and again, the folks you're going to hear from now, Bob, Bill, Glenn, and Pam, are going to give a kind of an overview for all of you of where we are. I had a chance to see any of the selectmen's meetings, and if you have any questions, please jump in. So, Chief Sylvia, since the declaration of emergency, the selectmen adopted went into effect. we've been in what's called an incident command structure. All of this was set up through FEMA after Katrina and the disaster that left, not just literally, but from an organizational point of view. There were things that nobody was in charge. So one of the critical things here is that there's a whole structure, and we've been operating in this now for 46 days. So even before the declaration of emergency. So again, I want to thank everybody who's been working incredibly hard on this. And by the way, all of you who are adapting yourselves to make this thing work. And everyone in town has been really cooperating and working hard to get us through this. So with that said, I'll turn it over to Chief Sylvia to start.
Thank you, Chris. Thank you, Madam Chairman. So very, very quickly, I'll just go through this. Obviously, as Chris said, first week in March we got going, but actually we got going back in February. We started buying equipment at that point. Mary Goodwin came up with the thought process with Pam and a few others that we needed to be ready to go. So we started buying some equipment at that point, which was a good thing. So as you can see, these are kind of the bullet points where we are. We started and we built the incident command system out, and I am the so-called incident commander, which very simply, I want you to know that this is a collaborative effort, and I would be very remiss if I didn't tell you that the public health agents, so Pam, Mary Goodwin, Chris, Miriam, Brian Joyce, Ron and Bart, as well as Chief Quigley and myself, we meet 6 days a week. We were meeting 7 days a week. They told me that we could take Sunday off. I don't know if that's happened yet, but we meet 6 days a week at 8 o'clock every morning because this thing turns over almost every 24 hours. There's new information. There's new things that we have to do. Twice a week, we're joined by the schools, the finance director, health affairs, the procurement officer, and safe harbor coordinator. So this is really a collaborative effort amongst all of us to make this go. And everybody is doing yeoman's work. As you see on bullet point 3, we constantly monitor the U.S. Centers for Disease Control, DPH, and of course the WHO. We're constantly searching for the new guidance and the best practices so that we can keep ourselves in the town and our employees protected to the extent that we can. We also partner with South Shore Hospital. We have our medical director over there in the ER who works with all of our pre-hospital EMS folks. It's been a phenomenal collaboration with South Shore. Will Tollefson has been great to work with. He meets with, or he does a phone call with the EMS side of the house every week, and now he's doing one with the police side of the house every week to keep them up on the front end of exactly what's going on and what we need to change as far as our operations as quickly as these things change. We built out, I should say, let me back up. So we also do a weekly conference call with all department heads in the entire town. So it gives everyone the opportunity to get the latest information, the latest guidance, and to answer any questions that might come up. We also are doing that with staff members starting this week. So we'll do a conference call on this platform with every single staff member that wants to join us. And the idea is that they will all get their information from one source. And as I always tell everybody, be careful where you get your information from. The CDC, the DPH, South Shore Hospital, those are the go-tos for us. We're not believing what we're reading on the internet. Let's put it that way. We also created an infection control task force, which consists of health, Miriam, DPW, police and fire, the infection control officers of police and fire. And again, that was to give everybody the opportunity to have a go-to, somebody that they could pick up a phone and call to get a straight answer, that they were worried about maybe an exposure or a symptom or whatever the case may be. Not that all of us are epidemiologists, but what we do is we make sure that we get the straight answer for that question. We don't make it up as we go along. Simple as that. As you see, we continue to meet with employee groups as necessary. Whenever new guidance comes out, We go and make sure that we meet with them. We met with DPW and RTF last week to talk about exposures, and because again, Chris mentioned the RTF guys, and you don't think about this, but they're as exposed as anybody. They're bumping into people constantly, and we're working really hard to make sure that they're protected. The last couple of pieces on that are the CDC guidance on cloth face coverings. As Franny mentioned earlier, procedure masks and N95s, everybody's seen everything that's in the news. They're very difficult to come by. So that's a good look on Chris, by the way. So we've started a cloth mask initiative. If you can't see Chris, you're gonna have to speak up or whatever. So you're come up. There you go. So we've started a cloth mask initiative, and the whole idea behind the cloth mask initiative is to make sure that people have access to cloth masks. I have mine, of course. Okay, we got a friend of mine created that for me. So cloth masks so that we could provide them to all of our town employees. Chris is wearing one that Ronnie Goodwin donated 100 of those for all the town employees. So everybody would have access to a mask, a cloth face covering, I should say, but a mask. And the idea is that we're saving the procedure masks and the N95s for the EMS folks that need them, that desperately need them. So on top of that, we've also reached out to a bunch of different groups in town, and we've put it up on our website, and we're trying to, in essence, get a homegrown sewing circle that will provide masks for all that need them. We've made sure that we put out through the CDC, there was a very quick DIY, or DIY, I should say, and you could create one yourself, very simply with a bandana and a couple of hair bands. I don't have a lot of hair bands, so I had to get my friend to make me one. But that's kind of what's going on from a very quick point of our COVID working group. And now I'm going to let kind of Chief Quigley and Pam and Glenn fill you in on the rest of it.
Can I get a question to the
Chief
chief?
has covered most of this.
Hold on just a second, Chief. I always do this. Are there any questions in regards to what I went through before we kick this off?
Yes, it's Mike Dick with a question. You mentioned your sources of information. Are you getting updates on the risk levels for infection for our town? Is there any quantification of how much risk we face? Low, medium, high, ultra high?
Well, what we try to do with everybody, Michael, is we treat every single soul that we bump into as if they're radioactive. The simple fact is that this virus is they're telling us that 25% of the people out there will never show a symptom, but they will be contagious. On top of that, the other thing that scares us to death is that people can be contagious for anywhere from 48 to 72 hours before they become symptomatic. So what is the risk out in the general public right now? I don't get within 6 feet of anybody but my family members, and I make sure I wear a mask every place I go. The mask isn't going to protect me from them. It's going to protect them from me. And that's why we're working on a mask initiative, and I think Pam will kind of speak to that in a second. But that's what the driver behind the face coverings are, that we don't know. So are we at high risk? Absolutely. I know that's the kind of, I get to be Johnny Raincloud. It's what I do every morning at 0800.
Question from Lee, please. You have to unmute yourself. Yes, go ahead, Lee.
Just a quick question. How many cases are there have been in Cohasset from the start? Do you know?
We put that out every Friday, and I think the number is at this point, I think we're at 14.
Yes.
But again, Pam will speak to that momentarily because there's actually news on that as of today.
Okay, so the next speaker is Pam. Do you want to speak next? Is that okay, Chris?
However, I mean, however you want to handle it. I mean,
Okay,
either.
yes, Pam? You
Sure.
want to-
That.
Yes.
Thank you very much.
And Pam is our public health agent. Thank you for being
Right, and so I should probably just start off and say, so our health department basically consists of me, I'm the public health agent, and Mary Goodwin, who's the public health nurse. So I think we can kind of break it down. We've been working in 3 different stages. Our first stage was the planning phase, and sometime during the winter, it might have been February, we did go ahead and buy masks and thermometers and alcohol wipes to give to people that did come down with the virus. And so that was really good because, you know, not only do we spend the money while we still had it, but all that stuff was still out there. I mean, now it's like really tough to get a thermometer or get a mask. Then kind of our second phase, once we got the first case at the beginning of March, we kind of switched more into like a communication education mode where we were educating not only the public, but also like employees in the buildings as well. And now more in the current phase right now, we do have approximately, I think, 18 or 19 cases that Mary is monitoring. And luckily, it's a lot of work. So luckily, she has the support of the public school nurses. So that's great because they were going to be paid anyway, and now they're not working for the schools. So it's been a great workforce for her, and it's been no extra cost whatsoever. We do have one other nurse that supports her. It's her normal backup, and her costs have been paid through grants. We've received 2 different grants from the Department of Public Health, and so that should cover us all the way straight through. I hope. I think it could take us like we have like a year's worth of money, I think, for at her rate. So what the public health nurses are doing is they're monitoring the health data from the different cases. They have to call them every day and enter their information into the public health database. And a big piece of it is they have to do contact tracing. They have to interview all these people, find out who their close contacts were, and then report that information to the Department of Public Health. And then DPH follows through and they contact the towns where those people all lived in. So it ends up being like a big, almost like a spider web network kind of thing. And then for what I've kind of moved on, I'm focusing more on the businesses in town. About 3 weeks ago, I had to let all the personal care businesses know that they could no longer be open based on Governor Baker's order. And then from there, we've moved on to anybody that's considered non-essential had to close. So kind of informing those people. And currently I'm trying to take an inventory of all the businesses in town and see who's open, who's closed, and of those that are still open, are they following the proper social distancing guidelines? And then like 2 of the biggest commercial entities in town are the grocery stores, and making sure that they're following their guidelines. They have their own separate grocery store and pharmacy guidelines, and basically they have to limit the number of people in there. Like, so they have to do 40% of the normal maximum capacity. And then the Board of Health, we're going to have a meeting tomorrow night to discuss whether or not they need to institute any additional policies above and beyond what the governor's issued. Like, for example, making it mandatory to wear masks, especially inside grocery stores and, you know, any kind of public places. So those are the main things. I don't think, let me know if you have any questions.
I have a question. Where are you? There you are. The question is, I heard that there was a $300 fine for people who are not obeying the distancing, who are gathering in groups. Is that true in Cohasset?
So that was really brought about because there was a big problem at the beach, and Chief Quigley can speak to this as well. It's really like people like teenagers and kids from college in their early 20s that were not obeying social distancing at all, you know, and gathering at the beach. There was a lot of people like having parties and stuff like that. So it kind of became a tool that really the health department and the police department kind of collaborated. And, you know, we put out a letter saying this is public health emergency. And the State Department of Public Health let it be known that local boards of health do have the power to impose $300 fines for anybody caught not following social distancing. I don't think anybody's really been charged $300 though, have they, Chief? I think it's been more of a threat more than anything.
Yeah, we did, thankfully we haven't had to do that.
Okay. Lee, question. You can demute, you're muted, so yeah, go ahead.
How many active cases do we have in town that you know of? In other words, they may have had it, but
Right.
out of any active cases do we have? Roughly.
All right, so I don't see the numbers like Mary does. She was the one that works with it directly. I think roughly, they're following about 18 cases, and I think about 6 have been resolved, so that would be like 12.
And just to piggyback on Pam, so the notice that we are putting out every week caveats that by reminding everyone, as Chief Sylvia mentioned earlier too, that there's a lot of asymptomatic people who are completely contagious, light symptom people who are contagious, and people who are genuinely sick. I mean, not hospitalization level sick, whose doctors say go home and cure and heal at home. They're not getting tested. So the fact is that while that's the official number, it's only a fraction of the actual number of cases. We simply don't know what that number is. Believe me, I'd love to know it as much as everyone else would. I will also let you know that just today, of Public Health began releasing this data on a town-by-town basis, and it's going to be reported on Wednesdays. We report on Fridays, so the numbers we report might be a little different than what the state reports on Wednesdays. And they're just going to give the total number of cases. And again, if anything else to add on that, Pam.
And the reason why they decided to do that now is because initially they were really adamant that we weren't supposed to report by town the number of cases that we had, because really what happened, we were kind of like, case number 2. And when it became obvious there was one case in town, immediately everybody tried to figure out, all right, who is this person? So the whole reason why the DPH has been telling people only report by county is because they wanted to protect people's privacy. And now beginning today, they realize that it's so widespread that every town has multiple cases, that now it's appropriate to report by town, because once you get to like 20 cases, you're not really going to sit around and figure out like who are the 20 people. And particularly in bigger cities and stuff, it's like, who knows? So that was they really wanted to wait till it became completely widespread community spread, that they decided to finally start doing town by town.
Fran has a question. You have to demute. Unmute.
Let's see, I am unmuted. The question is what are we doing as a town in relation to testing, and are there any testing of equipment available from the towns through the state or through from whoever provides it? It seems to be a big problem, is that, as Chris just mentioned, there's a lot of people out there that have it, but we don't know, and they are contagious. So do we have any plans to have widespread general testing of the townspeople?
Well, the way it works is that Department of Public Health runs the testing, and they have a very complicated protocol because it's hard to get the testing materials, and it's also hard to get all the PPE that's necessary to take the test. Honestly, I think the PPE in some ways is almost a limiting factor. So they have to have a actual protocol and hierarchy how it gets done. So first responders like police and fire, they get first priority. And even then, it's not like anybody that's asymptomatic can't get a test. It has to be somebody that's been exposed, that's showing symptoms. And then after that, they've now moved up people that work in grocery stores, hospital workers, obviously, and this just goes all the way down the list until finally you get to people that are asymptomatic who don't get any tests at all. So you have to have a recommendation from your doctor. That's kind of probably like level 6. If hospital workers are number 1 and first responders are number 1, just your average Joe that is not feeling well, that has a fever and goes to their primary care physician, you're kind of low on the list. But if you go to a facility that has a clinic within it that does testing, then you could probably get a test. But at this point, are we doing widespread testing throughout the town? That's not happening. It's not happening anywhere. We just don't have the materials or the PPE.
Okay.
Okay. Any more questions? Okay, continue. Pam, are you done with your presentation?
I am.
Okay, the next one up would be,
Yeah, I think Chief Quigley. Let's move to the chief.
yeah, Chief Quigley. Thank you, Chief.
Hi there. Chief Sylvia covered most of what's been going on. The question about the citations that was an interesting question. That was more or less a tool that we used to help people understand how important and this is. We haven't had to issue any citations, and we really we developed a unique procedure where officers were finding carloads of kids at night, just basically hanging out together in the cars. 4 or 5 kids in a car that weren't the kids weren't related. So we started taking their names down, and with the help of Pam, we issued a letter. The Board of Health issued a letter to the parents, and it would be delivered by the school resource officer the next morning, letting the parents know what the kids were up to, and that remind them that we're in the middle of a health crisis here. And that's sort of once we did about 4 or 5 of those letters, that spread like wildfire throughout the town and throughout the parents and the schools. So that really solved the problem almost immediately. I think Pam would agree. So there was no need for draconian fines or anything like that. So that was a great ending to the drama that we were finding at Sandy Beach.
Thank you.
Beyond that, Chris had put up a graphic that we came up with on the screen. If you could throw that up there again. We sort of, as a police department, I divided this into phases. And during February was the pre-planning phase, and you can see, I'm not going to read through everything. You guys have this, I believe. I sent it to the chair and the vice chair. And then throughout the month of March was a lot of education and increased readiness on the part of the department. We basically got our ducks in a row. We changed some procedures. We issued new policy and some guidance for the officers and our personnel to be safe. Right now in April, we're in our emergency operations phase. We've limited, some of the services that we offer the public. For now, we've really boiled down into the core of what we do. Answering emergency calls. I can say in the last week, it's been getting really busy. The offices, we are burning through the PPE. It's great that we have the device to sterilize these things at the station. That's saving a lot of our cache of equipment. The officers are wearing the mask while on the station. We're trying to encourage people to stay out of the station, but sometimes we just have to return there to complete a report or something like that. But for the most part, we're trying to keep people outside of the station. And you'll see the officers on the street, they are wearing their masks, and when they're interacting with people. Hopefully by next month, we'll be in a recovery phase where we could sort of assess reassess this whole situation and start replacing equipment that we've used, do a deep clean of the station, and start working on an after actions report for you folks. If there's any specific questions, I can answer those. But we're just working hard every day, and and the funny thing is we're having just yesterday we had a town from the North Shore. I won't mention the town, but they're so impressed with the way we're doing things. How town government is functioning, the police, the fire department, emergency management, the Board of Health, how well we're all interacting. They're asking, how we're doing it. They're looking for guidance from us. So it's sort of nice to get that type of feedback from, they're really not even our neighbors. They're from the North Shore. So word is spreading. We've also fielded calls from as far south as New Jersey. We were the second, we had the second confirmed case in the state for a small town. And a lot of these police departments have reached out and asked, they've copied our procedures that we had to come up with. And we've said this 100 times, there's no real handbook on this, but now there sort of is, and we wrote it. So it's been sort of cool. but I'm open for any questions.
Mary?
I'm unmuted.
Yeah.
Thank you all so much, really. And I have a couple questions, and I'm not really sure who's best to address them. But I guess, first of all, for our first responders and our town employees, is there a sense of confidence that you have the PPE that you need to keep yourself as safe as is humanly possible in the middle of this?
Yeah, I think there is. We started early. That was the key. We started back in January and in February, and we hit our vendors. I could speak for the police department. We ordered a lot of stuff in advance, and it was just that came out of just a side conversation I had with our infection control officer. Every police department in the state has to have an infection control officer. He handles all of our medical supplies. We were just having a general discussion. And I had been reading online the New York Times, and was reading about this sort of coming this way. And I said, just to be safe, we should order some extra stuff. And we ramped it up. So we really get in on the ground floor, and we had a pretty good supply ahead of us before things went south. And we know Mary Goodwin and Chief Sylvia had talked as well about thermometers and things like that. So it was really fortunate for us to get after this so early.
Mm-hmm.
The two things that I would mention is that obviously the procedure masks and the N95s, we're in pretty good shape as far as that goes. What we're beginning to worry about is the burn rate on gowns, because the appropriate PPE that we are wearing whenever we go to a call, and as I said, at this point, every single person for an EMS call that we go to that has any type of symptom, it's immediately a full gown, gloves, a face shield, and a mask. Usually an N95, but we are trying to, and I'm just real quick on this. We actually had a high school senior that is making our face shields for us.
I saw that.
Using the 3D printer from the school. Yeah. So Noah Sullivan, who is Alex Sullivan's son, he showed up at just the right time. And that's been phenomenal. The one thing we're beginning to worry about is gowns. Okay. And you see that across, if you turn on the news every day, I think every EMS worker right now is having that same thought. And they're difficult to come by. We've got Tyvek suits. We've got all sorts of stuff that we're ready to deploy as needed. But that's the question becomes with this. When does this come to an end? And there's so many different theories right now that we may be in this for the long haul. Is it going to slow down during the summer? Is it going to pop back up back in the fall? So right now we're in pretty good shape. And we tracked, as Glenn mentioned earlier, we tracked the burn rate on all of our PPE. But that being said, we don't know what we don't know. And the biggest unknown right now is how long are we going to be at this? So we hope the supply chains will start to free up some more stuff. And some people are being very thinking outside the box. They're talking about reusable gowns. Especially in hospital settings, but even for us, we have a laundry system at the station that we put in luckily this winter for our, as part of our cancer prevention program, and it's being used for all sorts of other things right now. So if we can continue to get the supplies and this doesn't go on forever, then we should be in good shape.
Okay.
Thank you, Chief. Yeah.
And then I have one more question. Sorry. Chris, obviously all of our first responders, your RTF employees, outside of that, how many town employees are still coming in to work?
I'm just sharing, by the way. Bill just sent me a picture. If you could see on the screen, you can see those guys wearing plastic gowns. That's PPE. And then the masks, right? Am I describing that right, guys?
Yep,
that's correct.
Which was this is the driver we had stopped on 3A during the storm the other night. I don't even know what day it is anymore. I think it's Tuesday. The storm was Tuesday. But the driver, while we were talking to the driver, he collapsed saying, he was having all kinds of symptoms, COVID-19. So we had to, call for the ambulance. And once they evaluated him, this is how it plays out on scene. But those are the gowns that the firefighters wear, along with the face masks and the eye shields, gloves. They're totally suited up. And, as you can imagine, when they're through with this patient at the hospital, the whole ambulance has to be disinfected.
Yeah.
You zoom out there, Chris, a little bit, you'll see the blue car. You'll see the blue car to the left. The guy was actually on the ground, behind the car. You can see we wrapped him in a blanket as best we could, but the officers dealt with him, until the fire department could get there, as best we could. But we were using our PPE as well. So right, case just like this, it's 6 of us, burning through X number of garments, to deal with just one person.
I didn't mean to sidetrack you, Mary.
Oh, no. I was just curious, other than your first responders, obviously, and the folks at RTF, how many employees, just roughly kind of percentage-wise, are having to come in and out of the town buildings?
So we're trying to limit it to as few as possible. For example, the entire library staff is working remotely. And they're doing a great job, by the way. I don't know if anyone's actually taken up on any of their offerings, but they're doing daily, readings of kids' books, and they're doing all kinds of other online programs. So they're all working from home. In the senior center, they're primarily in the building, but not all of them. Some of them are doing some work from home. Like one of the things they're doing is calling people, homebound seniors, regularly to stay in touch, make sure they're okay. Be done from anywhere. But the folks who actually do the Meals on Wheels program, that's actually based out of the senior center, so they come in to do that work. In this building, for example, here at town, and again, so Rec as well. Rec's not really in the building. Ted might pop in to do some claims, but he's mostly at home. Here in this building, we try to limit it to no more than one person in an office, if that. So to a large, like Don, for example, has been working from home pretty much from the beginning of this, but he can do this whole thing from home. Jane comes in once a week just to, because we still, unfortunately, there's a fair amount of paper in this process. We can't shed at this point. So she can make sure we pay bills. And Paula's staff, I think, rotates, so there's no more than one of them in the office. So they kind of go through a rotational cycle on different days of the week and different, mornings and afternoons to make sure that we process all the paperwork and all the bills. The clerk's here every day, but her assistant is not. Her assistant's working from home all the time. And then the building department and Pam's team pretty much every day based out of her office, because that's her office. One of the nice things is, we don't share, the shared space, but everyone has their own desk. So like, for example, I'm here, that we're not disinfecting my office every day. Good cleaning, but that's a whole nother issue. It's paper more than germs. But we're trying to limit the number of people in any building at any given time. The schools, for example, are empty. That said, some of the IT staff are still based out of there because we have an office. Ron has an office here. He'll come in here sometimes.
Mm-hmm.
So for the most part, Mary, whoever can work from home is working from home.
Okay.
Okay, is that kind of answer your question?
Do we have to furlough anybody? Are we incurring any unemployment?
No. So we made a decision. I made the decision collectively with all of us right up front that we were going to keep everybody on the payroll. Okay. Now they have to be able to work. This is not a vacation. It's not a paid vacation. So we even maintain, we have a handful, like the van drivers. We're not putting a 75-year-old person in harm's way. So we're still paying them. They're 10 or 12 hours a week. It was the right thing to do. So we're keeping, there was a handful of regularly scheduled part-timers, but everyone else who's on salary is either on a rotation. For example, the public works are kind of on A and B shifts. So they can all come in if they need to, but they're on kind of an A and B shift. Police and fire are operating on their regular schedules at this point. So people have days off, and here in the building, if people can work from home, they have, but everyone's still on payroll. In fact, we're avoiding this whole COVID-19 bonus sick leave the feds passed. The private sector can get reimbursed for anything they pay out, not the public sector apparently. So we're not touching that program right now. So if someone does, we actually have one person I think on quarantine because they have a spouse who works in a nursing home who was symptomatic. We're just keeping them on payroll. It's just easier at this point to do it that way.
Lee, question. You can unmute. You have to unmute.
Chris? Okay, can you hear me?
Yeah, I got you.
Okay, I have a couple questions. Number one, this is a little off subject, but I want to ask them anyways. The water rate study for the advisory board. Are there any more questions on the water rate? My wife asked me to ask this question. Any more questions on the water rate study? I think Mike was the only one that had a question. Was that answered for you, Mike?
That's
No,
not,
it has not been answered.
yeah, and that's not on the agenda for tonight.
Okay.
But I will say that we're going to be talking about all these things, Lisa. Don't worry. There will be time, and we're going to talk about all the budget stuff. So.
Well, I mean, I had some other questions here. May not be on the agenda, but it's important questions. Like at the transfer station, why is there a police officer there on time and a half?
Well, they're not actually. It's actually a detail. It's not a time and a half. They're up there now, Lee, because people were not remotely following social distancing or anything. They were packing in. They're bringing their stuff, and it was a madhouse. And we can't have our staff literally in harm's way because people aren't paying attention. So I wish we didn't have to do that. But the alternative would be closing the RTF, and that would be a far worse thing than having the police up there. Now, I'm hoping that people will take a step back and recognize that we can only have so many people on site at a time. And if they just take a little time and prepare at home, separate cycles, break down the boxes, they can get in and out. So that was something we had to do. Otherwise, our staff was going to rebel, and I wasn't going to have anybody there. And we would have had to shut the facility down. We can't do that. And by the way, Bill can correct me, but I don't think those are on overtime. I think those are detail officers, right? Bill?
No, that's a detail at the request of DPW. Yeah.
Yeah. So they're on like 4-hour blocks of time. So, but we're still paying for it. It's not free, but it's not time and a half.
It's not time and a half?
No, it's the detail rate. I don't know what that is off the top of my head, but it's not.
More than time and a half.
Okay. One other thing, the power outage yesterday, or on the thing, I talked to the chief, the fire chief. Let's see, there he is. You know, I felt personally that at 7:30 the power should have came on. It came on at 9. Something's wrong. So I'm just telling you, they're playing games with that. Let me see. How about the town meeting? Have we got a town meeting date yet?
So that's actually on the agenda. We'll talk about that in a few minutes.
Talk about that in a few minutes. Okay. Any more questions dealing with the emergency operations update? And then we're going to do the town meeting update. Okay. Thank you.
Yeah.
So
Helene, I have a question.
only if it has to do with the emergency operation. Okay.
Yes, it has to do with emergency operations. It
Okay.
really does.
Yes. Okay, Mike.
Thank you. We haven't talked about the water department or the sewer department and any risks to public health through those two agencies. I'm not sure who can take the question, whether it's Pam or someone else. But are there any concerns for our water supply? Are there any concerns with the sewer operation and virus infiltrating into our environment through those two channels?
Okay, thanks, Mike. Chris, you want to do that?
So if somebody wants to jump in on me, Pam.
Pam's got that. Chris.
Refer to Pam. Go ahead, Pam.
Okay. So the normal disinfection process that takes place does break it down. I mean, the COVID-19 is a coronavirus, right? So the common cold is a coronavirus. So the water treatment process breaks down the virus actually very easily. So there's no risk there whatsoever. And then same with the wastewater treatment plant. I mean, that breaks down all viruses. You know, the COVID-19 is just one more virus. And so it takes care of it. And so half the town's on sewer and the other half of the town is on septic. And even the septic system should also break it down by the time it gets out into a leaching field and leaches down through the soils and stuff. Again, it should be broken down. So there really is no extra risk through those two pathways.
Thank you. Okay, Meg.
Just a couple of quick questions, and apologies if you already said this, but I had heard today that the state expects to get about, I think it was 260,000 gowns from the federal government. Do we get any of those, or does that kind of stay at the state level and go to the hospitals?
I mean, I think Glenn could probably talk to this more than I, but what happens is we make requests. So yes, there are supplies that come down to us. In fact, we got a delivery last week, I believe, Glenn, right, of some supplies?
Yes, we got a delivery last Thursday of supplies that we had asked probably 2 weeks ahead of time. The way it works is MEMA, we're in contact with MEMA every day. When we request supplies, we have to tell them what our burn rate is, what our inventory is, and then they assess it with everything else that's been requested that day, and they'll try to make some agreement with us, say, well, will this hold you over at this date? And they send it. But it's very difficult to get materials from people, not because they don't want to give them to us, it's just
Right.
it's such short supply.
Yeah, okay. And then I guess just my only other question, because a lot of people have asked, is just how we can help support the town and Chief Quigley and Chief Sylvia. The answer may be we can't right now, but if there's anything that people can do, I think a lot of people want to help.
We have, for a few weeks now, we've had a volunteer registration form on the town website, and about 54 people have stepped forward and said they could help at certain times. Probably 10 or 12 of them have been given assignments to date. So as the event becomes more and more clear what's happening, we know how we can use people best. One of the biggest users of volunteers right now is the food program, which is being run by the senior center. The whole world of watching out for our seniors and taking care of those at risk and the people who live at 60 Elm is a collaboration between the senior center, the Social Service League. There's a Laurel Hickey runs an organization called Launch, and they and the Food Quest and Food Pantry, so they have that pretty well covered, and so they are using a number of volunteers for
okay.
So,
Right. Yeah.
so that we feel is very well covered.
Yes, and the Social Service League made a big donation to the food pantry. And also we are sponsoring a good part of what Laurel's doing with Launch.
Yes, the Social Service League is they're helping to pay for some of the meals. They are providing cash to be used as Launch helps people buy things at the stores, and then they get reimbursed. And it's just a tremendous partner for everybody.
Great, thank you. That's all I have.
And again, so one of the things, just to follow up, and I would require me to do this. So masks, wear masks, encourage wearing, make it a fashion statement. If we can help get masks made and distributed in town, that would be great too. I think we've been trying to kind of figure out a way to maybe more formalize that. I know there's a couple of groups working. Again, encourage people, stay home and be safe as much as possible. I mean, we're not chaining people up in their houses. We've done a lot of work collaboratively with the folks at Sandy Beach and the trustees even to try to keep their facilities open, quietly in some cases, and more publicly in others. With the beach, for example, we've had people yell at us for closing it. We've had people yell at us for keeping it open. So, and that's okay. We kind of split the baby, and we've been just keeping it open in the mornings. Poor Annette Sawchuk I spoke with was getting beaten up, and I said, look, direct the calls to me. And we had some intense calls on our morning ops calls because we need to make sure that people have a place to recreate and to blow off some steam and to feel nature. When people were doing wine and cheese parties and play dates at the beach, we realized we had to do something. So unfortunately, afternoons
Well,
are
my 3-year-old was very excited when the police showed up at the beach at 1 to kick us off. So he is a supporter.
There you go. So hopefully we can extend those hours as we get deeper into this and people behave. The concern is that if the weather gets start warm, we can have sunbathers, and we can't have that kind of stuff, I'm afraid, back yet. It's not going to work.
Aaron Collins has
safe.
You have to.
There was a pattern. There was a pattern last week in the Mariner how to make a mask. And are there any? Oops, did I get unmuted or am I got muted?
You're fine.
Unmuted. All right. There was a pattern in the Mariner on how to make the masks. Is there any approved material or anything that shouldn't be used? Where is some of this material available? And how general is this information, and where can we get this stuff?
So very quickly, the CDC has a site on cloth masks. They have an advisory on cloth masks, and part of it is a do-it-yourself. And it talks exactly to what type of material to use and how to make them. And legitimately, a couple of layers of cotton will work just as well as anything else. It's just the idea. The mask by wearing a face covering, what you're doing is you're preventing you from spreading droplets into anything. So you're protecting others from you by wearing a mask. So it doesn't have to be anything really fancy. I've seen ski masks, I've seen scarves, I've seen bandanas. To see people walking into a bank wearing a bandana and a pair of glasses, dark glasses, is a little disconcerting, but I'm only a firefighter, so I don't worry about it. But it's right there on the CDC site. We tried to, I think we've linked it to the town website on our COVID information, so it's there also. And that's it. The other comment real quick about volunteers, we're trying to develop right now, we're going to develop a volunteer task force. What we've asked from every one of our department heads is to think outside the box in ways that volunteers can help. And what we're trying to do is put together first a task list. Once we have that, we already have the volunteers. We have a lot of people that have signed up. Now, how do we mix the two and make it work? Because we don't want to put certain people in harm's way, as Glenn mentioned. So we're working on that, and we're hoping that we'll have that task force put together by the end of the week. We've had some people that have volunteered to be part of that task force. So that's what kind of where we are going with that right at the moment.
Thanks, Chief Sylvia. Okay, can we move ahead to the town meeting update?
Okay, so where we are, obviously town meeting had to be postponed. We were actually, by the way, just to turn back the clock for a second, we were in a good place. We were 2 weeks out of really being wrapped up. We had the capital budget in its final home stretch. We had CPC in its final home stretch. We had the school budget teed up, and then we were pretty much done. And then, of course, everything stopped. Now, what's happened in the interim is that obviously our budgets are going to have to be tweaked. We've started to take a hard look at where we are, and I'm not telling you anything you don't already surmise that we're going to cut back our revenue estimates because we have to. There's things we're not going to see next year. We're still waiting for the state to give us a little bit clearer signal, but they expect some multiple billions not to be available to them this coming year, the end of this year and the coming year. One of the things, but before I get more into the budget, so the current of June 22nd, so that the selectmen established dates of June 22nd for town meeting, which is a Monday, and June 27th, which is the following Saturday for the town election. The town election cannot go past June 30th, so June 27th is where it's going to stay. It looks like if we don't get an answer in the next 2 weeks from FEMA, we're going to have to move the town meeting back to June 15th, and let me explain why. There are FEMA flood maps, not the ocean flood maps we were years ago. These are flood maps that deal with every other water body, streams, lakes, rivers. All of us have them. And these new flood maps had a deadline of adoption, and they're routine. Everyone's fine with them. We're good to go. It was on the warrant and their deadline for adoption is June 19th. Now, despite the fact that we're in a lockdown and we can't have groups of, more than a handful of people together, FEMA does not recognize that town meeting is not a city council that we can do a meeting just like this. So they're like, well, just, the governor gave you a pass, so just do whatever you need to do and get it adopted because, you have to. It's like, well, it's not quite that easy. So us and all the other couple hundred communities that are town meeting that haven't adopted this yet are going to be in the same boat. So if we don't adopt it by June 19th, the whole thing blows up and we're out of the flood insurance program. Not a really good thing to be happening in June as we go into hurricane season. So we may have to move the town meeting at least to start to June 15th, just to make sure that we're covered. And that will, just mean we'll have a tighter time frame in May. So I'm just letting you know that we won't set the date. Will not move until the selectmen meet in 2 weeks. But I'm just letting you all know that. So,
Chris, what was it now? What did we had it?
June 22nd is the.
Yeah, that's what I thought.
Yeah. So, but I'm just letting you all know we may have to move to the 15th. It may be that the 15th is just that one article, and then we have the rest of the meeting the next week. We don't want to make it too complicated because we have to set up the whole room and the whole 9 yards. That said, we want to make sure we have enough time to do these things. Another piece of the town meeting discussion is, we were looking at a 36 article warrant. Probably could have done it in a night, would have taken a long night, but it could have been done. And there were 7 zoning articles. All but one of them were fairly, I don't want to say they're minor, but they were, they made ground through. And in fact, I believe that you folks had already green lighted a few of them and the selectmen were ready to do that. we're having conversations. The planning board's actually meeting right now, so I they may already be done by now. Then we're going to be talking about whether or not to hold some or all of those zoning articles to a meeting in the fall. Probably December, by the way, would be the special town meeting this year. Because we may also have to do budget adjustments depending on how things work out again in December. And what amounts to almost like I know we don't normally do those kinds of things, but because of the circumstances, we may need to have a more robust second annual town meeting for all intents and purposes in December.
Do you know when in December that may be, Chris?
Yeah, it'll be early in December. We have the presidential election coming up. Obviously, doing it in October would be problematic, and then we don't want to do it, right after the election. There'll be, a lot going on, and then we jump into Thanksgiving, and then so we'll probably look at something early in December. Haven't set a date yet, but we've done that in the past. This will be more than a 15-minute meeting, though. It'll probably be longer than that. We may even take up capital, and one of the other things we're talking about is we kind of scale back capital and just, we don't want to go into a turtle shell here because, if we need it, there's heavy equipment, there's a new ambulance, there's stuff that we really need to do. And the earlier that we're in the queue, the better we're going to get the product. If they're not building ambulances today, we don't want to be the number 750 on the list, and we're going to be waiting till 2014 to get it. So that said, there are some other things that we just may have, like the street sweeper, we'll live without the street sweeper. I know we can rent them because we had 3 of them when I was trying to film a video a few weeks ago. Skip and Con. So we can rent those, so we don't need to spend $250,000 on a street sweeper if we can rent one or 3. So those are the hard conversations we're having right now about scaling back on capital as well, and seeing there's ways that we could shrink the meeting a little bit and make it a little easier. Because I'm not sure if people want to spend 3 or 4 hours, even if we're socially distancing in the gym. So I'm recommending, Helene, that you all start to think about meeting a little bit more regularly, maybe, and circulate some dates. We're going to still be on this platform for a little bit, but we're working on some budget amendments, which are going to float by the selectmen, I think, in 2 weeks, and then we'll start talking to all of you. And then I think we need to take a hard look at the warrant as it is. There might be some things you want to revote. For example, we may be pulling back, we had those one-time cost items. I don't know that we're going to be recommending putting money into some of those things anymore. We need to hold every bit of free cash we have for budgetary needs. If the state if people don't pay their property taxes, we expect people to pay their property taxes, by the way, even if they're delayed till June 1.
So you and I, Chris, will work on setting up like some meetings. I foresee that we will be doing that probably in May, if not sooner.
So if we do a June 15th meeting, we basically have the first 3 weeks of May to really bang this out. It's going to be tight. But again, we were really deeply into the warrant as it was. So that said, we're already talking with the schools about the budget too. So Don and I have met with Patrick and Michael and the chairs of each of the boards, and we've had a pretty just calm but blunt discussion that we have to do some modifications. Don has also shaken every tree and looked at every dollar we can find, because we don't also, I've talked to some of my colleagues. They're talking about layoffs and shutting the library. We're not going to do that. That doesn't make any sense. We're not in a panic mode, right? We don't want to touch we don't want to touch the main reserve fund, right? It's about what's in there down close to $4 million.
Yeah, I believe just over 4.
That's a tsunami fund. It's raining really hard, but we really need to keep that in reserve in case it gets any worse. But there's other reserve funds, and again, we won't go into all the details tonight, but we actually have funds that we think we can plug in. We're going to have to do some budget cuts. We're trying to minimize them. We don't want to have to lay people off. We don't want to have to cut services. We want to have as soft a landing as possible for staff and for citizens alike. That said, we also have to be practical about where we are and see where we end up. So the next few weeks are going to tell some of that. But truth be told, I think we're going to have to adopt a budget and move forward and then monitor it as tightly as possible. And quite frankly, we're probably coming back in December and we'll make some changes. They may be draconian changes. I hope not. Things that we don't want to do. We may be more positive. I mean, you know, there's a tremendous uncertainty. That said, we're AAA credit. We're in good shape, and we don't have to make those draconian cuts today. And we have time. The most important thing that we have is time, because we just don't know what's happening. So
Right. And I see most of us are not going anywhere out of town, you know, in the next 4 or 5 weeks. So I don't think it'll be hard to get us all together. I mean, this is the first time the 9 of us have been together in a while. So I think this format works. Mary?
Yeah, just a question, Chris. I know Michael McMillan is leaving. When is his last day?
So the school committee, his last day is June 30th, I believe, but a woman named Susan Owens, is that correct, Don, has been hired. She actually followed Michael in Wareham.
Oh, that's funny.
She's the business administrator in Wareham. She had been in Sharon. So she has had some substantial experience. So she's starting here. So she's been hired. And Michael and her will overlap. And then I'm sure that she and Don will talk. And Miriam and Johnson and she will talk. So we'll be getting up to speed very quickly.
But it's just nice to know that he's around till the end you know, whatever they
Yes.
need to do to their budget. It's nice that he's here till the end of June.
Right.
Yeah.
Okay. Yeah, that's really good. Anyway, any other questions? And I guess.
see Meg. Meg has her hand up.
I have a question.
Okay, sure.
Chris, I'm just curious, and I'm an optimist here, so I'm not thinking this will happen, but curious if you've had any conversations about whether or not it will even be safe to have a big public meeting in June.
So Carol St. Pierre and I have started talking, and I did talk to the Dan Evans, by the way, is working from home in Cohasset. His entire firm is working from home, a couple thousand of them scattered around the world. So, and we talked about that. So, you know, I'm hoping that by June, you know, we can pull this off. And now the gym is a big place. We usually only use about half of it. So if we set up, you know, socially distance across the whole gym, keep the doors open, keep the air flowing, and keep the meeting to a reasonable time. Make sure everyone's wearing, well, bring masks. Everyone has to wear a mask. I think we can pull it off. You know, that said, if we get to June 15th and it's still not okay, then there is a plan B or plan C, depending on how you want to look at it, default into the next fiscal year, and there's things we can do. They're draconian, but they're you know, we don't shut the doors. There's a way to continue, and if it gets any closer to that, I'm sure the legislature will do some other things too to help us out.
Yeah, Tom has a question.
There's a plan B, C.
Perfect, thanks, Chris.
Yes, Tom?
Chris, where is the legislation right now? I know you and I spoke in early March about a virtual town meeting. Why can't we revisit that? And my interpretation of the law is that it doesn't specifically preclude a virtual town meeting.
That's an excellent question. So as a matter of fact, the Mass Municipal Association Committee I serve on talked about this at our meeting last week. And actually, technically, it is not allowed at the moment. That said, there's legislation that's being discussed to allow it. However, we did talk about it as a group, and practically speaking, while a representative town meeting could probably be pulled off that way because you know exactly who's coming, even if it's 200 or 300 people. In our format of government with an open town meeting, we don't know no one's been able to quite crack how to figure that out, because one of the things, how do you validate? I mean, by the way, it's a great question, and I think it's going to have to be more fully explored. And I'm happy to talk with you offline, Tom, as well. The key is how do you have a platform that's going to accommodate? Because you could have, typically we have a couple hundred, right? We typically have between 300 and 500 people at a town meeting. You could theoretically have 3,000 people at a town meeting if people want to participate. And if you're doing it from home, it's possible more people would want to do that. So how do you have a platform that's robust? How do you even manage it, right? How do you validate that people are actually registered voters? How does the moderator manage the meeting? There's practical, doing the group we have tonight, the 16 of us on this call right now, you can make this work in a respectful way, particularly you can see everybody. I don't know practically, I don't think the technology, at least for us, is quite there. That said, the conversations are happening right now. So the the state legislature is looking at it, and the MMA is looking at it. And again, if you have some thoughts, Tom, we're happy to talk about it. And I'm happy to have some side conversations with you and the moderator. So.
Yeah, Chris, I think it is quite possible because my son is going to meetings with hundreds of people and he's using professional platforms. And I think it is quite possible because you need to have a good moderator. And I think the one issue is checking people in. There would have to be some sort of process, but that could be run by a person in charge. And there are organizations that are doing it and universities are doing it. I know that for a fact. And there are hundreds of people on the platform. And because there's no way that they're going to do another Biogen in Massachusetts. So they're going together a lot of, you know, he's a physicist and they're having big conferences online with hundreds of people. And they're doing them from different places in the world. So I think June 15th is really quick. You know, May, you know, we're right now in the peak and May is really a problem. And June 15th is only 8 weeks away. So I'd be really concerned about that. So I think we need to really think of a way to do that virtually. Tom?
Yeah, Helene, I'll work with Chris offline, but I think
I can't hear you.
You want mute?
We can't hear you.
You want mute, Tom?
What? You have to unmute it.
You're unmuted. I think your internet connection.
Yeah, I've got a poor internet connection. Chris, I'll email you with some ideas, but I know that the authentication of a voter is critical, and so that's what's different than just a big conference. So.
Exactly.
And that Tom, that is the biggest sticking point. Carol looked at me like I had 4 heads when I talked about it with her. Yeah, but again, if that could, you know, that could be overcome. If there's a way to overcome that with like a pre-check-in procedure or something, then it might work. So I think.
Mary, you have a question?
Yes, I think it's not just.
Mary had a question first, John. Mary? Yes.
I think John was first, but I'll spit it out. Way back in the day, we did have a town meeting at the Music Circus outside. I wonder if there would be a possibility, even in doing it on the turf field, for example, and literally spreading out there.
It's funny. I talked to Paul Durensis today about another topic, and he talked about a town that did an outdoor town meeting. So yes, I mean that's, you know, that could be part of it too. That might be a better answer is to do something. Of course, we have to make sure we have good weather, right? But we could, you know, you're right. The field we could potentially do something outside with the Music Circus. They've
that's too close.
Yeah, they're not doing any events right now. That's a much bigger facility too, right? They've closed all events for June. I'm not even sure when they're putting up the tent at this point. So, but it's again, we're looking at everything, just to be clear. So if anyone has any great ideas, and thank you for bringing that up, Mary.
John, question?
Yeah, well, comment. I think it's my concern would be not from some experience I've had on meetings that require voting. It's not just the authentication. It's how do you actually conduct the vote in a way that has integrity and meets sort of the record keeping requirements.
Yeah, thanks for that comment. Okay, Chris, are you done with the town?
It looks like I think Rob has a question too there, Helene.
Okay, Rob.
Mike has a question as well.
Okay, Rob, your question?
I'm sure that large boards of directors do this all the time. Corporate, nonprofit, et cetera. There's nothing's ever new. This is kind of new, and certainly town meeting is kind of new, but before inventing a product, you might take a look in that direction.
Okay, thank you. Mike?
This is a question for Pam and for Glenn. I would really want the health agent to be the arbiter of what is safe and what is not safe for the public in a public gathering. And it's all well and good for all of us here to give our best lights on what's safe and not, but I would rather that we apply a standard or standards for when it is safe to gather in a large group, because all we have heard is gathering in large groups is absolutely out of the question. And yes, We seem to be heading to a peak, but we don't know that yet. And I think it would make much more sense right now for us to have a set of standards that indicate that it is safe for a large group to gather, whether indoor or outdoor.
Thank you, Mike. Any more comments before we adjourn?
It's a great point, Mike, and it's definitely something that's been, we've been guided by health the whole way along here. We at this point, we're also just, we're speculating a little bit because we have to figure out, can we even pull something off? We're kind of making it up as we go along.
Yeah, Paula?
Yeah, I just want to switch gears, if you don't mind, and introduce a possible topic for consideration at a future meeting. As you know, back in January, we modified the investment policy for OPEB, investments. We included those. Those were not part of the policy at that time. But also in January, the governor signed a special act allowing us to invoke the prudent investor when it comes to trust funds. And I have gone ahead and modified the policy again to deal with that. And that's all it really does, is opens up the investments beyond the legal list to include prudent investments specifically for trust funds, because that's what we're allowed to do now. I forwarded it on to Tracy and asked her to forward it on to you folks. And if you would be kind enough to consider that at a future meeting, and I'll be happy to come and answer any questions you might have on that at your convenience.
Chris, can you make sure that goes on our agenda?
Yep, for your next meeting or whenever you want.
Yeah, thank you. I appreciate it. Thanks.
Thank you.
Any other comments before we adjourn? Well, I want to thank everybody for all their comments. We're going through a hard time right now. And having all the advisory board show up tonight is really, really good. And I appreciate your eagerness to work with the town and help our department chairs and all the different aspects of helping fight, the COVID-19 here in Cohasset, and as well as trying to deal with business issues that we have to deal with as a town. So thank you all for being part of this meeting tonight. And Chris and I will let you know as soon as possible when our other meeting will be, or meetings plural. Thank you. Is there a motion to adjourn the meeting?
I make the motion.
Okay, did you get that, Meg? That was Lee, I believe. Did somebody second the motion?
Nobody wants
Second, Mike Dick.
All in favor of adjourning the meeting, please say aye.
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 Okay, aye. Is that everybody? Mike? Yes?
Yes, aye.
Everybody? Okay, thank you all for coming and stay safe.
Thank you.
Thanks, everybody. Appreciate your time.
Thank you. Chris, we're done, right?
We're done. You can sign off. I have to wrap the meeting up and I have to lock down the recording of it.
Okay, because I could sign off then, right?
Yeah, you can sign off. Everyone can sign off. You're all good.
Bye.
Thanks, everybody.
Thanks, Chris.
Thank you.
Thanks, Fran.
Hey, Chris, can I ask you a question? Why did I not have the right link to get on?
I think some things got a little confused because we had the test meeting in this one. So yeah, so I'm glad we got you. So thank you for calling.
Yes, thank you for your persistence.
Yeah.
You know, old dogs and new tricks, this can be awful frustrating.
Yeah, but you did a great job there, Fran. So thanks.
Thank you.
All right. Good night, everybody.
Night, everybody.